Well, I have never been introduced in that capacity before, in that way before. My history is used to be a coach and a teacher, and when they would introduce the players, always last was the coach, and finally they say, and the coach is Jared Cleveland. So that's the best I've ever had, and I really appreciate it. And thank you, sir, for the kind words. One thing before I get started, I'd like to say is, in order to ever have anything move that has any kind of bureaucracy to it, you have to have people that are willing to work. And that's the thing. And it's not just me. I just get to talk about it, which is what I love to do. I love to talk about it. I love to talk about students. I love to talk about their health. And I love to talk about possibilities, because an education gives you options. Without no education, you have no option. And so that's where I'd like to begin. Just a little personal history. I crested 40 years old just the other day, and health really became an issue to me. Back in, I guess it was December, I realized that I was heavier than I needed to be. My father went through years ago having heart bypass. My uncle's a doctor. My mother is an avid health enthusiast, and my wife tells me I was too big. And she said, we need to lose weight. I'll help you. I'll lose weight with you. And so we lost weight. And, it's important to me that I live a long time. I want to see my kids grow. I'd like to make sure that my wife doesn't have to have a second husband, in the future. And, I just want to be healthy and happy. I've been married to Christy for 18 years. She's over here with the camera because she knows this is probably my only chance to speak in public. We have 3 sons, 16, 12, and 6. So I have a vested interest in my school district and the kids that go there, because I have 3. My parents are Herschel and Leon de Cleveland of Paris. My dad's, been an attorney for 40 years. He's back there in the back with a blue jacket on. I'm glad he came. Anyway, my mother was a long-time administrator. She was an elementary teacher, and was a principal for 20, 25 years. And in fact, a quick story is I was her boss, and that's not normal. That's not normal, and sometimes it wasn't good. But for the most part, it was very good. Learned a lot from her. Cut my teeth at a small school district called Magazine. About 550 kids, high free and reduced lunch population. And, a lot of kids hurt, a lot of parents hurt, a lot of splits, lots of alcoholism, lots of drugs. And so I learned how to be a superintendent that cares, because I needed to, because many of those kids had nobody to care about them. So it's a quick history. Education, I went to school at Arkansas Tech, finished up there, degree in 93. 94, I went back and got my education credentials because I was waiting on law school. I was going to go to law school just like my dad, and figured out my LSAT score was pretty good, just not enough to get into U of A at the time. There were plenty of folks that, there, and I guess I didn't meet the cut. So I was going to go to school at Tulsa. And, I started taking these education classes, waiting on that period, and I knew that law school just wasn't for me. And my dad told me one day, we were driving back from Tulsa, he said, Jared, he said, everybody that comes to my door has a life-altering, life-changing problem. Are you sure you're ready for that? And I said, no. And now everybody that comes to my door has a life-altering, life-changing problem because it deals with their kid. But anyway, I went into administration, finished my degree in 2003. 2006, received my specialist degree, and I expect to, hopefully, if my dissertation passes muster, have my doctorate in the spring. Well, why are we here? Why is this backwoods superintendent here talking about health when he doesn't have a health degree, he's not a doctor, any of that? Well, I'm a practitioner of children, okay? I want to tell you about the brief history of school-based health centers, and we call them wellness centers here in the state, and why we are where we are, why we're behind. I want to address the many needs for these centers. I want to talk to you a little bit about what one looks like. Many folks think about, what a center looks like in their mind, but I'm going to give you some pictures. I'm going to show you what it looks like. the picture's worth 1,000 words. We'll look at the components, capacity, financial aspects, and then if you want to begin one, you can. It's not hard and it doesn't take a whole lot of money. I'm going to talk to you about how to do that. Well, what is the history behind these centers? Nationally, these have been around a long time. In the 70s, there was a big push to do this in Texas and California even, New York City, St. Paul, Minnesota. They began to develop these health centers for students. One was in Dallas, not too far away from us. Today, there are about 1,700 of these health centers across the country serving about 2 million kiddos. Now, that sounds like a lot, okay? How many is really 2 million kids? You know, we have 467,173 students, I think, in Arkansas. So that's not too many. Now, that's just K-12, all right? Nationally, 40%, as you can see, of the students have no other medical home than that school-based center. Why? Well, we're going to get into that. If you'd like to know any more, you can go to the National Assembly of School-Based Healthcare. That's a link, and I think they're going to post this PowerPoint to their website, so you can hit those. It'll be a hot link for you. All right, let's look at need in Arkansas. Why would Arkansas need a school-based health center? Well, for K-12 in 2010, our student population was 467,061. 59% of those kids qualified for free and reduced lunch. Now, there's a strong correlation between free and reduced and Medicaid eligibility, okay? So the percentage of public school children that have Medicaid coverage is 53%. So you can see that correlation's pretty high. Now, last year was 52. So what's happened? We've had an economic impact in Arkansas too. You know, I've heard the governor talk, I've heard a lot of other folks say Arkansas has been buffered just a little, but it's beginning to impact us. We're not ever hit as hard as the rest of the country. It's a little bit slower, but we're hit, you know, when the economics are bad at the national level, they're bad everywhere. Okay. Well, when you look at these percentages, and I got my sources, Medicaid in the Schools, Tony Boaz and Tracy Starks over there, they provide me with lots of information. In fact, they are some go-to people for me, just like Miss Wanda Shockey in Child Nutrition that I see back there. There, she raised her hand. There are some others in the room too, but why are these kids, why do they need Medicaid? What causes them to need assistance? Kids are kids, whether they're black, white, yellow, green, poor, rich, whatever. Kids are kids. And, you know, as an educator, I see them under one umbrella. I don't see them as poor. I don't see them as white. I don't see them as tall or short. They're kids. And that's how we look and try to decide on what's best for all of them. Because most of the time, there's no cookie-cutter approach to what's good, is there? One size doesn't necessarily always fit all. Okay. Many of the students that qualify for Medicaid don't have Medicaid for one reason or the other. You know, it's an annual process. They have to reapply. And so sometimes kids are caught without that continuity of care. Elizabeth, did I say that right? Okay. Okay. She helps me. I probably should introduce her, but I don't want to embarrass her. Okay. There are currently over 345,000 kids aged 3 to 20 on Medicaid in the state. Why did I use that figure? Medicaid gave it to me. But many of the kids who qualify for Medicaid are in special ed. Anybody know how long a special ed child can stay in a public school? 21. Okay? 21. Early periodic screening, diagnosis, and treatment. I was introduced to this a couple of years ago. People kept talking about EPSDTs. Elizabeth said it 1,000 times. I'm like, I don't want to be stupid. I don't want to have to ask what it is. So I went back and asked my school nurse. It's a screening. That's what it is. And so I became versed on what it is and why it's needed. An EPSDT, in my educational vernacular, okay, is a well child health screen. Okay? Many of these kids, well, most of the Medicaid kids are supposed to get them. In fact, they set the bar at 80%. You Medicaid folks out there, I see you nodding your head. I know that's right. In Arkansas, do any of you know what the percentage is that actually are seen? Anybody? Is 34%. You're a great student. You're a great, I should have covered that up, shouldn't I? All right, 34%. So you can see that's a poor rate. But there are some bright spots in Arkansas. Why is it 34%? Did you know it used to be worse? I ought to cover this up. I'm not going to. Let's look at the screen. Head Start and the ABC programs, they require those kiddos who get to go to pre-K and to daycare to have those screens. So that's bolstered some of those numbers. It was at 24%. 24%. If I made it 24% on a test, would I pass or fail? I'm going to fail, okay, and fail miserably. But you can see that these kids are needing to get their screens. That's where we find out if we're sick or not, or if there's a problem or not. I'm going to ask another question. I'm not going to ask you to raise your hand because my wife certainly gets aggravated at me when I ask for participation, but I like that. I'm a teacher. That's who I am. I'm going to ask you. I'm going to do it anyway. How many of you in here have ever had to work on your home air conditioner or replace one? I see Doc back there. Did it cost you a tremendous amount of money? It does, okay? I had an HVAC person out to my house to look at my air conditioner because I was really scared that it wasn't cooling. And I said, okay, Ken, what's the damage? What am I going to do? Do I have to replace it? And he said, oh, you're lucky this time. Just a service call, just some filters and some things. This is $300. I said, what would this cost if I had to replace it? Upwards of $6,000 or $7,000 because I didn't do maintenance. EPS DT screens, maintenance on kids. I didn't change the filter on my air conditioner. I didn't check the Freon levels. I didn't do those things. I didn't take care of it. It should have cost me a lot more than a few $100s. We get lucky like that with kids too. We were very fortunate. Most of the time, those kids in that age range don't have symptoms. Okay? I'll tell you a quick story about something that happened in our clinic. John Bronesty, right up here in the front, is the APN there. Dr. Sanders is our doctor. We have Miss Wanda Sanders over there, and she runs the clinic. Isn't that right? She's the wife. She is fantastic. She's also a nurse and has a heart for not only kids, but the community. And if you lived at Lavaca, you'd know that. Quick story. Small child over at the elementary school, feeling weak, fatigued. Mother is a nurse at the Heart Center in Fort Smith. She didn't have time to come pick him up, come check him, so the dad came. And John may have to help me out with the story, but to make a long story short, they took the child to the wellness center. John said, there's something wrong with this child. He needs to go to the hospital. They're saying, well, can we take him more? No, he needs to go now. He wound up at Children's Hospital, and he had full-blown diabetes. Now, I have the permission of the parent to talk about it because I asked him, I said, there are going to be other folks that want to know how this clinic works. Can I use your story? He said, sure, I have a story of my own. This summer, my 6-year-old I've already talked about was very ill. He wouldn't eat. When he could eat, he'd throw it up. He went from being very healthy one day to the next 3 days, he looked like a stray dog. You know what I'm talking about? Bony and frail and no energy. And we took him to the pediatrician. And my wife came back and said, no, he's got a virus. You have to let it run its course. One day, John comes in my office, talking to him. I said, what is wrong with my kid? Well, where have you been? We start talking about where we've been, what lakes he's been in, what he's had to drink, what he's had to eat. He said, you need to test that kid for Giardia. I said, can you do it? No. Take him to the doctor. Guess what he had? Giardia. Wish I'd have gone to John first, But our clinic plays a huge and vital role in the health of our children. One of the major reasons it plays such a vital role is because those people care. It's their community. John lives in Van Buren, but we're trying to really get he and his wife over to Lavaca as fast as we can. Right, John? We talk about it all the time. they care. They have relationships with the people that are there. Dr. Sanders and his wife, I was telling you a second ago how they care about the community. They have a car show. They organize a car show. They do all kinds of 5K runs, and their son's involved, I believe, in the he's a firefighter, right? Yeah. So they're involved in everything. They have deep roots, and it's just a natural relationship for him to be involved at the clinic. We're just fortunate he's a doctor. What are the barriers? You know, I've kind of hit on some barriers already, but what are barriers to students not being able to be healthy? Part of it's our current economic climate. Going back to my air conditioner, I really didn't have the money to pay $200 or $300 to fix that thing, but did I have the money to pay to replace it? And that's where we are with our kids today. Geography is another barrier. One of the major reasons kids aren't receiving services is because the services are located in population centers. Little Rock, Fort Smith, Texarkana, Northwest Arkansas. The little school I told you about where I came from, Magazine, there's nothing there. The closest place is Boonville. It's several miles away. I mean, it's pretty close. They have a hospital, but my grandmother lives there. She doesn't even want to drive there. She walks to town. She's, 88, I think, and she walks as opposed to drive. So she's certainly not going to go to the doctor. The providers aren't at the schools. That's where the kids are. They're at the schools. Here's something I didn't know until recently. I can see why some doctors may not want to practice in Arkansas because they're not necessarily treated fairly in their reimbursement. Okay? If you look at the reimbursement, I believe it's for an EPSDT, it's $56.41. The surrounding states range, the lowest is $82.51. The highest is $92.63. Well, frankly, I don't want to be behind Oklahoma. I've been to Oklahoma. Arkansas is way better. No offense to anybody who loves Oklahoma, but we're way better, and we should treat our doctors better. They provide services that we can get nowhere else. You know, my grandfather and I used to go fishing together, and we would always talk these deep philosophical talks when I could get some words out of him. And one day he told me, he said that you invest in what you value. Okay, I'm an educator. I want you taxpayers to pay so your kids get an education. I want to invest in students because that's what you pay me to do, because I value them. I'd probably do it anyway. Okay? Just like many of you. Another barrier, access to caretakers. Their parents. Parents can't get their kids places because they work. And many times the jobs that they have, if I don't work, I don't get paid. So something's got to give. You know, do I feed my kid or do I take him to pay for a high-priced medical exam? Transportation could be an issue. Even in Lavaca, and I think that we're a pretty good little community that you know, we have some well-off, we have some really poor, some pockets of poverty, but most of us are packed there in the middle. Even those folks that are in the middle, they don't have gas money or sometimes a car, or they hadn't paid their insurance, or I mean, they're just, life happens and causes all kinds of problems for them. Another thing that we're beginning to run into at Lavaca is language barrier. I was talking to a good friend of mine, Dr. Jim Rollins, who's the superintendent of Springdale, last Friday, and he was talking about the huge divide, the huge language divide. They're having to teach many of the Hispanic population that will come in English just so they can communicate back and forth at parent-teacher conferences. They have to have interpreters there. So there's a huge divide. If we can't communicate on just the simple things, how in the world are we going to take care of the big things that aren't seen? The other part is the inconsistent enrollment as far as the annual updates. My mother used to say it all the time, especially right before she whipped me, an ounce of prevention is worth a pound of cure. I'm going to prevent you from doing this again. Okay? It stands to reason if we can prevent medical issues, we'll spend far less on treatment. It goes back to the air conditioner. I'm real simple. I like analogies, and I keep thinking that. I keep thinking if we maintain what we have, if we maintain our kids, then we're going to spend far less. And I've got a graph that's going to knock your socks off in just a second. But if you look at our budget for the state, I went and pulled this up, 2010, $24.7 billion with a B. 20% of that budget goes for Medicaid. Now that's Medicare, Medicaid, the whole bit, okay? Look at this. This is a beautiful graph, by the way. Medicaid did a great job putting this out. And I stole it from Elizabeth. I think I stole it from you. I've read all your stuff, by the way. It's fantastic. Anyway, you look at hospital inpatient. Can you read those numbers? I know it's kind of small. I wish I could zoom in. 743, what's that? Billion. All right? If you look over on the left, it's kind of by itself, EPSDT. Can you see that little piece of the pie? We're doing some screenings. But if we had a bigger piece of the EPSDT piece of the pie, that big blue piece would be much smaller. I believe. It's just a theory, but I think it's worth a shot. Source of funding for our clinics. Nationally, we have the Maternal and Child Health Block Grant under Title V, and it's of the Social Security Act. In Arkansas, we have the money because of our governor. And I have to give credit where credit is due, regardless of politics. You know, of course, I'm a big fan anyway. But we wouldn't have this money, this opportunity, if it wasn't for him. What he's done is he has allowed monies to be taken from the tobacco excise tax and placed to pilot these programs. Okay? If you need some more information, I have this at the bottom. It's the National Assembly on School-Based Healthcare website. There's some information from there where I got the information for national numbers. Now, this is real wordy. I only put this on here because I know it's going to be put on the website, but I'm just going to talk about it, okay? When you look at what the feds are doing, and like I say, regardless of politics, I believe the heart's in the right place. We had the Health and Human Service Secretary, Kathleen Sebelius, did I say that correctly? Okay. And Education Secretary, Arnie Duncan, they focus on this particular issue. And basically what they say is exactly what I believe, and many of you others in here believe. If a student is unhealthy, then they're less likely to be successful, not only in the academic arena, but in the arena of life. Okay? So if we can get hold of kids early on, and we can teach them not only fix their teeth and give them medication for headaches, those kinds of things, but teach them how to prevent cavities, how to prevent obesity, how to prevent sexually transmitted diseases, and on and on and on and on. If we can prevent those, then in the end, we will maybe not win, but they will. That kid will. Okay. There are many grants that are going out right now, especially at the national level. I believe some were just awarded. Gurdon, Arkansas, and I may have it on the slide here. Gurdon, Arkansas, and St. Something in Springdale was awarded about $500,000. The most important thing on this slide is what Arnie Duncan says. We know that if kids aren't healthy, then kids can't learn. That may be a little bit of an over-exaggeration, because I was unhealthy many times when my mom said, no, you're going to school. And I apparently did learn. But look at what Mary Wakefield says. These grants will improve access to care for children and help maximize their potential to learn. The grants are for the medical centers. The medical centers are for kids. And in Lavaca, when we get to that, I'll tell you it's not just for kids, it's for the community as well. Do school-based health centers take patients away from local providers? That answer is unequivocally no. In fact, there are partnerships that are formed. Better communication for each individual child between maybe their home provider and the school provider. And many times, as you saw before, 40% of those kids, their medical home would be Dr. Sanders. Okay? The health centers are another entry point for children who may not otherwise be able or willing to seek outside help. Most of the time, the kids that are having difficulty are from 13 up because they're too tough to go. They're too good to go. I'm not sick, I'm not hurt, I'm okay. Until, you get run down enough you have to go. Do parents favor the health centers? If they're educated on what it is, they do. If they're educated on what it could do for them and their child. Remember me telling you about, a parent comes to my door and they have a life-altering, life-changing problem? If your kid is sick and you can't fix it, that is a life-altering, life-changing problem. And for those of you that have children, you know exactly what I mean because I've been there. If the clinic is located at the school, you're sending them there anyway, most of the time, okay? Then you don't have to leave work. And if you trust the provider and if you trust the school, they're going to call you, they're going to talk to you about what's happening and then get your permission for them to see the clinic, and your kid will be served. The clinic services are provided whether or not the student has Medicaid, private insurance, or the ability to pay. That last one could be a sticking point for some folks. And that's something we're just going to have to get over. We're going to have to get over that. Somebody pays. Nothing's for free. We know that. But, folks like Dr. Sanders and John Bronesty, they understand that. Because the agreement that we have there, it came out of their mouth before I ever had to mention it, was, we'll take care of those kids that can't. It's okay. We don't even need to talk about it. It's okay. So shouldn't schools just focus on education? Well, folks, that's what we're doing. We have gone from just in the classroom to whole child. And what we've done at Lavaca is we've now gone to whole family. Because, let me back up. All through my administrative learning, I kept hearing from professors, it all goes back to the home. It goes back to the home. You can't fix the home. You can't change the home. Why not? Why not? Why can't you? If you don't attempt to, you're certainly going to fail. And if you fail at the home level, the kid is doomed. So if we can provide supports for parents, not only does it gain trust between the parent and the school, it improves the opportunities, again, for not only the child, but in our case at Lavaca, we serve the community as well. So it's a bridge, where somebody might not have been so happy with the school in times past before I got there, I'm sure. And every day, okay? Am I kidding? But at least they trust that we have the best interest of every child at heart. And you don't have to go to the clinic. They can opt out. You don't have to. We have to have permission. But look at the bottom bullet. Students without the clinics are less likely to get medical care, so they often come to school sick. They spread illnesses to teachers and peers, and thus distract from the process of learning for everyone. Again, very wordy. What's a school-based health center? And I don't know if you can see that, but I've been telling you about what they are. It provides preventative care. It provides medical care that may be necessary. It could even provide urgent care. We also provide dental care, optometric care, audiological care, and something that is near and dear to me, which is mental health. Just because you can't see a mental health issue doesn't mean it's not relevant, not there. We see it every day. And if we went back to that big piece of the pie that Medicaid pays for, a significant chunk is for mental health. Okay? So it's there. It may be hidden, but we need to talk about it. It's worth talking about. And, as you can see from the PowerPoint here, there are many ways that we communicate with parents to make sure that it's okay for us to serve the child. What are the benefits? My goodness. I haven't found yet a negative. Somebody's going to point something out to me, but at this point, I haven't found one. We're going to look at the healthcare needs of each child, and we're going to meet them. We're going to support students by providing a safe place to talk about sensitive issues that, they may not be able to talk about with folks, but they might be able to talk about with their nurse or with their doctor, somebody they trust. It supports the school environment by helping children stay in school and by identifying and addressing health problems that may intervene in the learning process. Mental health, oral health, audiological health. Just a quick little story. This last spring, we screened all of the 9th graders and 10th graders right before the end of course exams. 12 needed glasses. Couldn't see a little bit, needed glasses, okay? We got them their glasses right before the test. It's 1,000 wonders that we caught it. It was just, hey, we have this, what do you think we need, is it okay to do that? And I was like, yeah, absolutely. And it wasn't my idea, it was a school nurse. Wonderful, wonderful. But that's our focus. It supports families by allowing parents to stay at work while attending to their child's routine health care needs. It saves money by keeping children out of hospitals and emergency rooms. It teaches students to be better health care consumers themselves. And it strengthens the connection between the community and the school, which is vital today. All right. Coordinated School Health and Wellness Center Initiative. Now, my slides are going to go quickly from now on. I know I don't even have a timer, but somebody will let me know when I've gone too long, right? Yes? Okay. The funding from Act 180 of 2009, it's the tobacco excise tax. The Department of Education, the Office of Coordinated School Health, in collaboration with the Department of Health, the Department of Human Services, Arkansas Center for Health Improvement, and Arkansas Children's Hospital, it's awarded 9 Coordinated School Health and Wellness Center Initiative. We call them CSH and WCI grants to promote health, wellness, and academic achievement in Arkansas public schools. There are 3 goals to this initiative. Implementation of the 8-component model of coordinated school health to improve academic achievement, number 1. School health programs, number 2. And community support, number 3. The establishment of Level 1 Wellness Center, and I'll talk a little bit about that in just a minute. And development of a quality school-based mental health program within the Wellness Center. These are the original 9 Wellness Center recipients and the second wave. Now, we applied for and received the Wellness Center grant. One of the stipulations was you had to be a school or a coordinated school health school. And we do that voluntarily. It doesn't cost us anything. We don't get any money for it. There used to be a little money. But what it is your board, the administration, the teachers, the community say, okay, we're going to focus on health, not only education, but we're going to look at the components of health, and we're going to implement those components. For example, we have a water-only vending policy. That doesn't sound like a big deal, but let me tell you, when we started talking about it, it became a big deal. Because the high school principal said, there goes my Coke fund. I don't have any discretionary money. Don't worry, we'll make it up. You can see the recipients on the left. On the right is the second wave. Now, I do need to tell you the second wave is just a little bit different. The first grant was guaranteed $175,000 a year for 3 years. Actually, the third year is $200,000, but I didn't want to put too much on the screen. The second wave is a little different in how they broke up the money. The folks are still going to get the same amount of money as they would if it were a 3-year program, but it's going to be stretched over 5. So they get quite a bit the first year, a little bit less, a little bit less, a little bit less. The weaning process. They'd love to do that to us in education. Let's look at the Lavaca Wellness Center. Sorry, I wasn't trying to be funny on that particular piece. The Lavaca Wellness Center is a school-based health clinic that's located at the middle school. And like I say, I'm going to show you some pictures, but the clinic serves students and staff of the Lavaca Public School District, and they also serve the community at large. In fact, it's not just Lavaca, it's the River Valley. When Dr. Sanders came to run the clinic, he already had a well-established patient base in Fort Smith. I mean, people were traveling from Lavaca to see him. Now they're just thrilled that they don't have to travel that far. This is probably out of order, but I'm going to ask how many folders or how many files you actually have. Didn't you say at your clinic? Okay. It's quite a bit. He just started in January, but now he brought some of those with him. Business hours from 9 to 5, and I'll just tell you, I don't think Dr. Sanders actually works those hours. I think they're much longer, okay? Partly because of who he is. The services that are provided, well, there are 5 major components. I've talked to you about them already. Medical, dental, audiological, optometric, and mental health. We partner with Vista Health, and they come in and take care of us. What do you have to start one? Well, the first thing you need probably is money, but After going through this process, I've already talked to a few superintendents, and we have a plan that you don't have to have somebody else's money. You can use your own. And I can talk to you about that after the program if you like. But we're going to build that. You have to have a vision. You have to have determination. You have to have energy and drive. You have to have a drive to go beyond the classroom. You know, you have to have a school board that wants to, that's willing to take some lumps. Because in the community, I mean, we've heard it before, it's illegal. You can't have private business in the school. Well, who said? You know, I've heard you got to have these public-private partnerships. I said I could go an hour without having any more, but I can't. Used to coach. I used to talk all day long. You have to have a community that's willing and that has a need. And you have to have the capacity to break down barriers. When you hear no, it can't be done, you have to say, well, you know, why not? Let's try. I used to get in trouble for that, again, with my mother. If you knew her, you'd say, oh, yeah, okay. Great lady. This is a picture of the opening day of our Lavaca Wellness Center taken January 3rd. It was amazing the number of people who showed up. Several state legislators. I wonder why. Okay? Many of them didn't even represent my district. But it's interesting. It's good. It's good. To take a line from Stephen Covey, you got to begin with the end in mind. You have to have a goal, and you have to go forward. One of the ladies I love most in life, other than my wife, is my curriculum coordinator that works at Lavaca. Her name is Sandra Smithson. I've learned so much from her. I dread the day that she retires, but you know, she's always telling me, when you're green, you're growing. When you're, you know, you're ripe, you're rotting. Because I get down in the mouth, and she's talking about herself, but she's constantly growing, and she is to retirement age, we'll say. But another thing she said that really started me was, sometimes when you don't know where to start. Just start. Anybody else have that same kind of understanding? Yeah, she's right. You got to gather support. You identify the needs. You survey the schools, survey the community. It takes work. I wore out a couple of pair of shoes. I went to several city council meetings. I met with individual council members. I met with the mayor. I met with the preachers. I met with anybody that'd meet with me and talk about it. Because I knew if I didn't do my homework and lay the groundwork properly, it would fail. Skip was talking about when he was on the school board in Little Rock. Back in the back room, they tried to do a medical center. A good friend of mine, Frank Coleman, who's at Lincoln now, he used to be the superintendent at Cabot. When he was at Lincoln before he was at Cabot, they tried to do a wellness center, a medical center. It failed miserably because it was a shotgun blast. People were not notified. They weren't contacted. They weren't surveyed. They didn't do their homework. It wasn't that he didn't mean to. They didn't know to. It was just different. And he told me the other day, he said, I think we set the state back 15 to 20 years. But he's glad. He's glad now because we are doing it right. Not just me, but all of those centers that you saw on the board. And even other school districts who don't have the money to back them as far as the grant money. Every wellness center will be different. If they're tailored to the community's needs, they'll be different. Just because our model at Lavaca might work for you, it might not. It's going to have some other nuances that are different. A good friend of mine, Sandra Beck, who's now the superintendent at Magazine, as you saw, they received the grant. You know, we worked with them tremendously because I knew, of course I love that place. They invested in me. I want to invest back with them. I tried to help them. And they did. They got the grant. But they're a little different. They're going to see, they have a community partnership with Boonville Community Hospital. They're not going to have everything we have. They're going to supply some other things we don't have. And they're not going to see the community just right off the bat. One of the things that made us very unique is the first day, Dr. Sanders and John, they were seeing folks. They were seeing people. It was full bore. When you looked at the Level 1 Wellness Center just a minute ago, Level 1, first part of the grant, hire a staff member, hire a nurse, kind of begin the process. If any of you know me, I don't do well at just beginning a process. You know, I want to go. Let's get it done. Why are we wasting time? And Anyway, I've got to move forward. Each one will be different. You have to educate the public on the identified need. Again, you meet with folks. You look for financial support and you build relationships. You look for grants. You look for donors. You look at folks that are wanting to participate. Maybe a retired doctor or a retired RN or somebody. There's somebody out there that cares for kids, I guarantee you. In fact, our optometrist, she's a stay-at-home mother. She has a degree. I mean, she's licensed. She works. Sometimes she moonlights. She'll go off on the weekends sometimes and work to keep her license. But she does everything for us at no charge. When you do have the medical folks and you talk to them, you need to show them that they can make it, because that's a big deal. When people say money's not everything, well, you're right, but you need it. You need to be able to make a living. Now, I will read this because this is important. This is what we believe. This is our vision. This is our mission, and these are our core values. Our vision: students and staff of Lavaca Public Schools will have quality, integrated school health services that improve health status, optimize academic achievement, and enhance well-being. Our mission is to collaborate with other school health providers or partners to promote, facilitate, and advocate for comprehensive, culturally competent health care in schools. And our core values are in universal access to affordable, high-quality health care provided in schools and communities, because good health is essential for student success, and health care, like public education, should be a right. We believe in advocating for the health of children and youth, and for the provision of high-quality, accessible, confidential, comprehensive, culturally competent health care in schools. We believe that, as a valuable component of health care delivery system, the health center should be appropriately funded and reimbursed. We believe that preventative and primary health care should be available where children are. That's in school. And we believe that children will not care what we know until they know that we care. Ugly picture. The purpose here is we talked to folks. We brought them in. We got them ready. We have monthly coordinated school health meetings where we bring people in. We invite the healthcare community, not only in Lavaca, but in Fort Smith. We invite the folks at the state level to come down. And they come, you know what? They want to. They like it. It's good. They want to see progress and success. And what we learn from them, they learn from us some too. We had a pre-K night in the fall before our community wellness center opened. And John was there. He didn't have to be there. He wasn't made to be there. He was talking to a pre-K parent. Hey, this is going to be good. This is what we're going to do. Somebody you need to know, Tamara Baker. She's not here tonight. She texted me and said, hey, I'm not going to be there. She had an issue, but she is very, very important, and she is the one that we bounce things off of. And, her success is our success is her success, and she lives it. She has a vision for this state. And Miss Wanda, beautiful Miss Wanda. Miss Wanda Shockey is the Director of Childhood Nutrition. She has helped us have gaps. Anybody ever see the Rocky movie, and I'm going to be kind of silly here, but, Rocky said he had some gaps, and his wife had some gaps, and together they didn't have any gaps. Okay, Wanda does that for us, just like Tamara, just like Elizabeth and others. A huge piece of health is nutrition. In fact, what you put in your body is what you use. And she is a great advocate for the state, and certainly has helped me out in tremendous ways and has grown me as an administrator and probably as a human. So I'm very grateful to her. Matt Griffin. Matt Griffin, he's the director of CURE, C-U-R-E. And I have some pamphlets over here on the table. But Dr. Griffin is a retired, I believe it's pharmacist. And he and his buddies, a bunch of other retired health folks, started a medical supply bank. And they were sending supplies all over the world. Haiti, Uganda, Thailand, everywhere. They were looking over the local area. At the time, our coordinated school health director, Miss Ann Sneed, she read a newspaper article about CURE and what they were doing. And so she said, hey, Jared, can I call them? I said, yeah, call them. See if they're, what they're doing. He loaded us up with medical supplies, thousands and thousands and thousands of dollars. And he's happy to do it. And we've contacted other school districts and said, here, Dr. Griffin is willing. And so now he's distributing these necessary items to these other schools that are starting. When I told you that there are some ways to start these things without grants. Okay, there's one. Dr. Sanders and Jonathan Bronstein are APN. The main reason why this is working is because they're willing. You have to find a dance partner to dance with you, and they are. And at first, the first few months, it was like, oh, Dr. Sanders, I hope you can eat. I hope you make enough money, just enough to eat. And he didn't ever come to me and say, he wasn't, but it was scary for a while. And because when you start a medical facility, you have to get Medicaid numbers and you have to get insurance numbers, and starting from scratch, and that takes a long time. I was introduced real quickly just how long it takes, but we survived. Relationships to be maintained for the services to continue for student, staff, and community. It's the relationships of everybody that are there. No one's any more important than anybody else. One of the main, gripes, it's a Western Arkansas word, right? Or is it a Central Arkansas word too? One of the gripes that I heard was, you're going to let public people in the school building? Yeah, it's a public place, but we're going to do it smart. We're going to have an outside entrance to the building where the community can go to access the doctors. And we're going to have a back door entrance where the students can come in. And they'll be ushered in to a waiting room and get to cut. That's a school term, right? Cut, we all understand that. So we designed the clinic for safety and security. The only thing we didn't do is we didn't design it big enough. There are 5 exam rooms and they're full all the time. And they're having to share with the dentist. So right now we are expanding into another classroom for the dentist and Vista Health and the audiologist and the optometrist. So that's a good thing. What services are provided at the center? It's the gamut of things. It's everything that a clinic would be. Everything that you can imagine. Primary care, comprehensive exams, sports physicals. They didn't charge a thing to do that. You know how much time that takes? Incredible. And that's a service right there. Laboratory tests, prescriptions, referrals. They communicate with other doctors too. It's not a standalone. Mental health services, health promotion and prevention, dental care with Dr. Friddle, and current plans to include vision care, x-rays, and telehealth. I think that's still on the marquee. Payment for services. Most insurance plans are accepted, Medicaid, ARKIDS, insurances of all kinds. A copay may be required, however, no child will be turned away because of the inability to pay. And I was telling somebody earlier, Arwitz provided us with $5,000 and said, hey, you need some money? Here's some money just on the side, just in case you have kids that can't pay. And we've got that money for glasses and, just things. They didn't have to give it to us, and all we had to do is say, yeah, we'll take it. What about prescriptions? No child is going to leave the school with a prescription. The doctors call those in. They can be delivered. Parents on their way home from work can pick them up and have them ready, for their kid when they meet at home. And currently plans are underway to build a pharmacy in Lavaca. So there are some things outside that impact us economically that are good. We don't have a pharmacy. It's hard to have a clinic without pharmacy. Well, now that's happening. That is in the plans. What's needed for a child to receive services? They need permission. That's all. They need parent permission. All students needing services must visit the school nurse first. She or he, in some cases, the gatekeeper. It's kind of like triage. Do you really need it? Are you just sick? Are you wanting out of class? What is it? And they can tell. And they have a great communication, great relationship with the folks at the clinic. And that's how that works. They also schedule dental appointments, eye exams, those kinds of things. If it's determined by the nurse that the student needs services, then they call the parent. No student will ever be sent directly to the clinic during school hours without an assessment from the school nurse, and students and staff services will be scheduled as soon as possible based upon acuity. Okay, If you can kind of look in the background, look at how kind of ugly that was. Okay, there used to be an old chalkboard back in the back. The building was built in 1965, and it's a huge building. We still use it, and we're renovating it as we speak. But we took 2 classrooms on the north side of the building and turned them into the clinic. Progress. Additional progress. And these 2 gentlemen are fantastic. They work for the district. They're in maintenance. So it took very little money. We're paying them anyway. They might as well be working. Cabinetry in the reception area. We went to like Pack Salvage or someplace, like a package store. Those aren't custom, but they look nice. It's part of the lab area. This is the lobby. It's huge. It's half of one of the 900 square foot classrooms. And, when we originally had the idea for the clinic, we didn't plan for Dr. Sanders. We kind of had something else going on the side. We were going to have a doctor oversee Mr. Bronesty. And then it just worked out. Our gaps were filled. Dr. Sanders was able to be there at full time, so we needed more space. And so we are going to expand in the near future. This is Dr. Sanders visiting with a vendor, and I took this yesterday, so forgive me. The office area, they're hard at work. I mean, it's nice. It's a nice clinic. It looks like it'd be in a hospital somewhere. And these are the 5 exam rooms. This is the same picture that you saw a minute ago where you had the studs and the concrete block walls in the back. So it didn't take long, and it didn't cost much. Everything you see here was provided by Cure. I didn't buy any of it. How much money's on the wall? John knows because he rifled through the warehouse for hours and hours and hours and gathered all this material. Now the dental chair, it's a throwback, but it's okay. It'll work. And we have plans. Dr. Griffin said, a nicer one comes in, he'll get us one. This is our station for the Wellness Center nurse. It's completely separate and away from the clinic itself. It's where the kids go, and she's our RN, and she does kind of the triage. Also located in the same office space. It used to be the principal's office. That's how much we appreciate and want this center to work. The office for behavioral health therapist. And it's nice. It's an inviting place. It's not cold and demeaning. It's nice. Here's where the rubber hits the road. If I show you any of these slides tonight, look at these. Look at the clinic data. In January, we started January 3rd, and we didn't keep up with the numbers probably the way we should, and that's my fault. And I know I'm running out of time. But they saw 432 people the first month they were open. Second month, 432. In March, 515. In April, I guess we had spring break or something, I don't know. In May, 432. I mean, look all the way across. Look at August, 546. At the top, you can see the kid numbers. Now, I don't know why the 120 in August, I guess physicals. School started, there we go. Shots and things, okay. But they're serving folks. In June, they gave me some numbers. 29 were self-pay, 23 were self-pay in July, and 34 were self-pay in August. What does that mean, self-pay? Okay, that means they just paid for it, either a cash clinic or non-Medicaid, non-insurance. Is that right? Something that's interesting to me as an administrator, which I think would help beat the drum a little bit for other administrators, the sick and personal day usage was down 21% from the previous 3 spring semesters. What does that mean for me as an administrator? That means my teachers are in their classrooms and they're getting quality instruction. No matter how good a sub is, they're not the teacher. Okay? That was important to me. Could it be directly attributed to the clinic? Well, I don't know. We're going to study that. 58 employees utilize the clinic for themselves or immediate family more than once. My family's worn it out over there, worn the door out. 81 employees have utilized the clinic at least once, and that's the data that I received from our folks. We have questions. There's my contact information. I'm open to anything. Yes, ma'am.
Well, we can give a round of applause first.
That's okay. Go
I
right
kind of
ahead.
hijacked that, sorry. Hi, my name is Hillary. I'm a Clinton School student here. Thank you so much for coming. This has been very interesting. My question is about preventative care pertaining to preventing sexually transmitted diseases and educating about that and teenage pregnancies and what services your clinic offers in terms of those things.
Well, the way we see that, that is something private between a patient and the doctor. The school really doesn't have a stance. And I say that with some reservation. I don't want anybody to know what I'm talking to my doctor about, okay? The clinic is a service, and they can go anywhere. They can choose to go anywhere. They can talk to their friends, or they can talk to a medical provider. Who do you want the kid to learn from? Or they can watch TV. I mean, I think a medical provider is probably the best to answer those questions. So what we say is we are a landlord to the medical center. What happens at the medical center happens at the medical center. Does that answer it? Probably not.
Sorry, I have one more question. In terms of, I guess my question is, in terms of getting parental permission, if a student wanted to come to the center and find out information about these things, would that be allowed, or is that something that needs to be run by the parent first?
Well, we certainly don't want to step on any parental rights, but we also have 2 school RNs that are very used, and those conversations remain private. So there's just not a lot I can tell you about it.
Any other questions? Professor Ernst.
This is not so much a question as it is a couple of riffing observations I'd like you just to respond to. And the first has to do with, you know, I spent a decade, 1 year, working for the mayor of San Francisco, and in most San Francisco high schools, there are these kinds of clinics, and it's sort of accepted. The other place I experienced it, frankly, was in Cuba, where there are pediatric clinics in every high school, at least in the urban areas. The power of that is amazing. But of course, you know what happens. You know the rhetoric is, well, a bunch of commie socialists doing stuff that shouldn't be done in the context of schools. But what I've heard from you tonight really is powerful for 1,000 reasons. But for me, it's also how you took the time to create a community conversation about a need for children that transcends ideology. It's like Governor Clinton says, you know, the problems in education are solved across this country in a variety of ways. We can just figure out a way to bring them together. But it strikes me that the real message of what you've done is how you create a community conversation about important stuff, particularly around the needs of our children. And as I think about rhetoric and our political context and what's going on in our democracy today, this is bigger than just providing children with health. It's about creating a foundation, it seems to me, Jared, about how we can talk about the most important subject on earth, which is how we improve the lives of our children. And I think we've lost that. I think this in some ways is a civic project as much as it is a health project. So I'd just like to say that, and it strikes me that the real power of your message, you know, you've got 75 counties to start working in, and I know that's not, you've got work to do in Lavaca. So I just want to observe that what you're doing is not just about trying to, and this is valuable and important, improve the health lives of children, but you're improving, I think, the very substance of what this country is about, which is how we have community dialogue to take care of really intractable, difficult problems. And we need you, man, to do this work. And I'm just proud that you're here and appreciate very much what I've heard tonight. Thank you.
Oh, thank you very much. Goodness. Oh, wow.
Jared, you can, when you go for your next school millage in Lavaca, you can bring Don up. He'll do radio commercials for you.
I believe he's got that voice, too. He's much smoother than I can be.
Okay, Annie.
Hey, good to see you again.
Nice to see you.
I'm Anna Strong, and I believe the last time we talked was when I was working on my capstone here at the Clinton School. I was just wondering if you could talk a little bit about, and this may be directed to you all as well as providers, on how we get the word out about this to other providers and help other rural communities in Arkansas and help the rest of Arkansas's kids have access to these services.
Okay. I'll say a little bit, but I know Dr. Sanders can really address this because he has the connections that are very important, especially in the medical community. But for us, it's just talking. You know, some of the most important conversations I have are with other superintendents, sitting at a table at supper at a superintendent symposium or something like that, because that's where they ask me the questions and that's where I ask the questions. I wore Jim Rollins out the other day. I wore Benny Gooden, Dr. Gooden from Fort Smith, out with questions at the commissioner's panel that he pulled together, about 15 of us from all across the state, talking about Common Core and some other things. But, you know, Dr. Rollins, I talked to him for a long time about his clinic, and you know, there are others out there that are willing. And it takes folks like you, and it takes folks like Elizabeth, and it takes folks like everybody that are in here that are interested in what's going on and what can change culture. That's what we're trying to do, is change the culture to where it's a conversation that's not politicized. You know, it's a need. You have to address the need. And okay, how do we do it?
Certainly that pretty well sums it up. It's talking. You got to get into the community, get around and show people that there's a need and a way to satisfy that need. And especially here in Arkansas, with the small towns around, like Jared said earlier, here in Arkansas there's a lot of small towns that don't have medical access, and that we're helping to find one way to do that, especially with all the talk about medical homes and things like that, that there needs to be some place identified, and certainly that's what we're trying to do in Lavaca.
Let me say a couple of things. Number one, I want to introduce a couple of people. He did introduce his dad, but you all need to know that this is the former Arkansas Speaker of the House, Herschel Cleveland, who's made an enormous contribution to great issues of public policy in Arkansas. So, Mr. Speaker, welcome. And we have with us tonight, I think, the person that focused Arkansas when she was First Lady of this state on the importance of children's health, the importance of getting families involved in immunizations, the importance of awareness. She traveled all over the state, later all over this country. She is from your neck of the woods, I might add. And we're honored to have her tonight. Would you welcome Betty Bumpers? So, Jared, I want to thank you very much for being here. I think this is an important dialogue to have. I think what you've done in a small town in northwest Arkansas is nothing short of remarkable, and I hope that your example inspires other people. I know the people at Arkansas Advocates that we work with, all they talk about is the work that you're doing and the example you're setting. And it's a great tribute to a small town. It's a great tribute to a state. And I do think, whether it be students at the Clinton School or members of Congress, everybody ought to take a good look at Lavaca, Arkansas, and see how they did it. Thank you all very much. Thank you, Jared.